the recording then. And we are, through the Emeriti Center, we are so happy to do our annual Medicare update workshop with Stephanie Fajuri, who is an expert. She's a lawyer. She has all these wonderful credentials, and she is from the Center for Healthcare Rights, which is a nonprofit organization, which is really wonderful. And it's a resource that you should definitely use if you ever have any questions. And so what I would like to do today is I'm going to put you in speaker view, Stephanie, and please take it away.
Great. Thank you so much. And I think if I can request everyone to mute themselves, we won't have any echoes. But I'm going to go ahead and share my screen so that you can see my slides. What I'm going to do today is talk a little bit about Medicare open enrollment and really specifically talk about comparing Medicare coverage options. I am going to try to leave some time for questions at the end. Some of this I'm going to go through a little bit quickly to make sure I can leave time for questions. But I like keeping questions to the end because I often find that questions that come up are often answered by later slides. So without further ado, we are going to talk a little bit about Medicare's open enrollment period and comparing coverage options. Thank you. Okay, so moving on here. A little information about the organization I work for and why I'm the one that's here providing this training. Center for Healthcare Rights is a nonprofit organization. We are based in Los Angeles, and we serve all Medicare beneficiaries who live in LA County. We are not part of Medicare, but we don't endorse any specific plans or companies. We don't sell insurance. We don't sell anything. But for anyone who has seen the Medicare and You book, perhaps you've received a copy in the past, one thing you may want to consider is turning it over to the back cover. The back cover has a phone number on it. It says, call this number for free personalized health insurance counseling. SHIP for California, California Health Insurance Counseling and Advocacy Program, HICAP. That phone number is the same one that's here on this slide. The HICAP statewide number, if you live in LA County, will get directed to us. If you happen to live in another county in California, you can still call that HICAP statewide number and it will route you to the HICAP program in the county where you live. So our services are primarily funded through the HICAP program. We are subcontractors for the city and county of Los Angeles, reporting up to the state and then reporting up to the federal government. I also recommend that you check out our website, healthcarerights.org. We do have a lot of educational information available on our site. And the reason I bring up our phone number is because, like I said, I'm going to try to answer as many questions as I can today. If you have questions down the road and you would like some personalized one-on-one assistance, you can give us a call to schedule an appointment to speak with one of our counselors over the telephone. Or we also have a list of our in-person counseling sites that are primarily staffed by volunteer counselors, and those are located throughout LA County. I also will put a plug in that we are always looking for new volunteer counselors. So as you are hearing about some of this information today, and if any of this is really appealing to you and you like the idea of being able to help people understand their Medicare coverage options, we likely would be starting our next round of volunteer training after the first of the year. So just keep that in mind. So today we're going to talk about what is open enrollment, how to compare your coverage options, when can you change plans, maybe outside of open enrollment. Maybe you're not looking to change plans right away, but down the road you might have questions. We'll talk a little bit about Part D costs. We do have some of that information available for this upcoming calendar year because it's open enrollment. And then I will mention the Part D Extra Help program. I'm not going to spend a lot of time on that, but I do want to make a quick plug in case anyone on the call or any friends or family might qualify for some assistance with drug costs. So first, what is open enrollment? Open enrollment is also known as the annual election period. This is the time of year not necessarily to sign up for Medicare for the first time, right? Presumably, many of you already have Medicare. Maybe all of you already have enrolled into Parts A and B. That's done through Social Security. May or may not be done when you turn 65. Lots of folks delay their Medicare enrollment until after they retire. And you can also sign up for Part D, a drug plan. D stands for drugs, during that sort of initial period when you're signing up for Medicare for the first time. Open enrollment in the fall is more for folks that already have Medicare to compare Part D drug plan options and or Medicare Advantage plans and make a decision about whether to stick with the plan they currently have or to change to another plan. Any change that is made during open enrollment becomes effective January 1st. And I see that there's at least one person who already has an appointment scheduled to speak with our agency at the beginning of November. So that's great to hear. I'm so glad to know that there are folks on the call that are familiar with HICAP. Okay, so as we are thinking about open enrollment or thinking about coverage options through Medicare in general, I have a few things on this preparation checklist that I recommend. So first, what kind of coverage do you currently have? Right? Do you have a standalone drug plan? Do you have what's called Original Medicare? We're going to talk a lot about the differences between Original Medicare and Medicare Advantage. Are you happy with your current coverage? If you're happy with it and nothing's really changing, you don't have to make a change during this period. But we know that this time of year is when the plans, whether that's Medicare Advantage or the standalone drug plans, announce the new premiums for the upcoming year. How much are you going to be paying for your prescriptions? Have they changed the list of drugs that they cover, their formulary? Are they going to continue to contract with the pharmacy that you use? Or if you have Medicare Advantage, do your doctors or hospitals plan to continue to accept that coverage in the upcoming year? This is the time of year where all of that is in flux. The other thing that's important to consider is what's actually important to you when it comes to your healthcare. I'm probably going to say this a few times throughout the presentation today, that there is no one size fits all Medicare coverage option for anyone. What's best for you might be different from what's best for your spouse or for your neighbor or your sibling, right? We hear lots and lots of noise about Medicare coverage options, but it really is a personal decision. If you have doctors or hospitals you want to keep using, they don't all necessarily accept every single plan option out there. Another thing to consider is how much you're paying for your current coverage. There may be less expensive options out there. So moving on to start diving a little bit more deeply into the difference between your different coverage options within Medicare and how to compare some of these things during open enrollment. So first, we have what's called a prescription drug plan. This is what's often known as a Part D plan. It's just a drug plan. It only covers your prescriptions. When you go that route, you continue to use what's called Original Medicare for your A and B services, or the other option is to enroll in what's called a Medicare Advantage plan, where you are assigning all of your Medicare coverage to a private insurance plan that then administers your Medicare benefits. parts A, B, and D. Part A is that hospital coverage. Part B is your outpatient doctor coverage. And then D is the drug coverage. So for my more visual learners here, I have the same thing I just mentioned, but a more visual representation. So everyone who has Medicare should have a red, white, and blue Medicare card. If you only have Part A coverage at this time, because maybe you're delaying your Part B until you or your spouse retires, that's totally fine. But when you have this, go this route, and you're looking at your drug coverage options, everyone has a red, white, and blue card. If you want flexibility to go to any doctor or any hospital that accepts Medicare, that would be Original Medicare. Pretty much every hospital throughout the country accepts Medicare. Most doctors accept Original Medicare, and then you get a standalone prescription drug plan. I will go into more detail about both of these options, so don't worry. But on the other hand, here we have Medicare Advantage. These are the private plans that are typically known as Part C. And I would encourage you to think of Part C as standing for choice, because it's an option. Neither of these are required. The default option when you enroll in Medicare is Original Medicare, but you certainly can select a Medicare Advantage plan covering your Parts A, B, and D benefits all together in one plan. Typically, these are HMOs where you are going to be working with a primary care doctor to get referrals to specialists, etc. I will go into more detail about both of these, but these are the two main options. So when we are talking about Original Medicare with a standalone prescription drug plan, as I mentioned, you're using Original Medicare for your hospital and doctor services, and you can go to any doctor or hospital that accepts Medicare. You typically do not need referrals to specialists, and you don't need prior authorizations for hospital and medical services. So if you decide, oh, I think I need to see a dermatologist, you don't have to get a referral to that dermatologist. You can just pick a dermatologist that accepts Medicare and go to them, just as an example. So one benefit of this route is you have so much flexibility. You can go to any doctor or hospital that accepts Medicare. It's basically an open network. Some people like to think of this as a PPO, and I would like to encourage you not to think of it that way, because even within a PPO, there's still a network. This is just fee-for-service Medicare. You're going to any doctor or hospital that accepts Medicare. The downside of this route is that Original Medicare only covers 80% of your healthcare costs. So you typically need to think about how to get secondary coverage for Medicare. Now, some people with low income may qualify for Medi-Cal. Medi-Cal is a great option as secondary coverage. A lot of other folks that have income that's too high for Medi-Cal are thinking about Medigaps or a Medicare supplement plan. And I know here within USC, there is also the option of USC Senior Care. Now, I'm not going to go into a lot of detail about USC Senior Care because I am not an expert about senior care, even though I have seen a number of presentations on the topic. It's a very similar idea to a Medigap, which I will share some more information about in a few slides. So thinking about these drug plans, these standalone drug plans, what are the things to consider during open enrollment? Which plans actually cover your prescriptions? How much is the monthly premium? What's the annual deductible? The deductible is how much you're going to pay out of your pocket before the plan kicks in and pays anything. And then, of course, you're going to want to know what the copays are when you actually go to the pharmacy to fill your prescriptions. Other things to consider are special rules, like do you need a prior authorization before the plan is going to approve a certain medication? Will you have quantity limits? There are certain medications that might be controlled substances or very expensive, where you may face either quantity limits or the plan might require something called step therapy, where you have to try a less expensive drug before the plan will actually approve the more expensive option. And then, of course, if you have a specific pharmacy that you prefer to use, you're going to want to know, is that pharmacy in network? And hopefully it's a preferred in-network pharmacy, because that's where you're going to get the lowest prices for your prescriptions. So if you decide, you know what, I want to have flexibility to see whichever doctors I want, I don't want to have to deal with, referrals and prior authorizations and a limited plan network, you're going to want to think about supplementing your Medicare coverage. So we talk a lot during the open enrollment period about the ability to switch back and forth between original Medicare or Medicare Advantage. And, you have all this flexibility, but the issue is that you might not always have flexibility about supplementing your coverage. I mentioned Medi-Cal already. I'm not going to go into more detail about Medi-Cal today. I know that for USC Senior Care, you can enroll. I think you have a lot more flexibility about enrollment into USC Senior Care than thinking about these Medicare supplement plans. I am going to share a couple of slides about Medigaps, but I know that a lot of folks on this call may already have senior care or may be considering that. And I will defer questions about USC Senior Care to Jeanette and to the other folks at USC. So what's a Medigap? A Medigap is a private insurance policy that typically covers some or all of the copays and deductibles for original Medicare. So I mentioned that original Medicare only covers 80% of your health insurance costs. So it's 80% of the Medicare approved amount for whatever the service is that you're getting. Well, that makes it really hard to budget if your doctor recommends, hey, you need an MRI. Great. Medicare is going to cover 80% of the Medicare approved cost of the MRI. So what does that mean? You're paying 20% of some unknown number. I don't know what the Medicare approved cost is for an MRI. So having a Medigap or having something like USC Senior Care can help you budget accordingly. You'll know how much you're paying out of pocket on a monthly basis for your care. And then typically once you actually receive services, you have little to no out of pocket costs. So for Medigaps, these are all standardized policies. They all have different letter names, just like the different parts of Medicare. It's lots of alphabet soup here when we're talking about Medicare and Medigaps. Some Medigaps have a foreign travel benefit that will cover care outside the US. Medicare on its own will not cover you outside the United States. So if you are, climbing up the Eiffel Tower in Paris and slip and twist your ankle or have a more serious injury, Medicare is not going to pay for that coverage. You're going to have to make sure you have some other type of coverage if you are traveling abroad in your retirement. The California Department of Insurance oversees these Medigap plans, and there's a lot of helpful information on the CDI website. So one issue with Medigaps, which I think, again, is separate from how the USC Senior Care program works, is that with Medigaps, typically the best time to sign up for a Medigap plan is the first 6 months that you have both Part A and B together for the first time. So if you're in a situation where you're currently, maybe you have Part A and you have the USC group health plan, and once you eventually retire, you're going to sign up for Part B, that's when your 6-month open enrollment period starts for a Medigap. I bring this up because, again, this open enrollment period or your ability to sign up for a Medigap does not necessarily line up with the Medicare Part D open enrollment period in the fall, which is what we're talking about right now. Now, why is that? Well, Medigap plans are not health insurance. They are not actually, even though they pay those Medicare copays, they're not actually part of the Medicare program. They're private insurance company, or sorry, private insurance plans. And because they're not health insurance, they actually can do medical underwriting, which means they can ask you questions about pre-existing conditions, your health status, if you are trying to apply outside of one of these periods where you have a guaranteed right to buy a plan. If you try to sign up for a plan outside of one of these guaranteed issue periods, they can ask you for medical history. They can impose pre-existing condition waiting periods. So just keep that in mind. Now, I do know that this fall, again, we don't endorse any specific insurance companies or plans, but I can tell you that Blue Shield of California is doing a medical underwriting holiday this fall. And so if you do not have Blue Shield and you are interested in signing up for a Medigap, you could potentially do that this fall through Blue Shield without having to worry about medical underwriting or questions about pre-existing conditions. And that plan would start January 1st. Okay, so thinking about original Medicare with a standalone drug plan, we talked about supplementing your coverage. What are some things to consider here with this general option? First, the flexibility, right? The flexibility is huge. The ability to go to any doctor or hospital that accepts Medicare, that's a really big draw for a lot of our clients that choose original Medicare. However, there are some downsides, right? The monthly costs can be substantial. The Part B premium is something that everyone pays to be enrolled in Medicare once you have Part B. The standard Part B premium for this upcoming year is $174.70. However, if you are what is considered a high earner for Medicare, they look at your tax return from 2 years ago. So if your income in 2022 as a single person was over $103,000 per year or over $206,000 per year as a married couple, you will pay more for your Part B and Part D premiums. So that's called the IRMA, or income related monthly adjustment amount. I can answer more questions about the IRMA later. I just wanted to flag that this is an additional monthly cost, which is why a lot of people delay that Part B while they're still working, because your income is typically higher while you're working. So with original Medicare, you're paying for Part B, potentially with a surcharge if you have an IRMA. You've got Part D premiums, those vary substantially. And again, if you're a high earner, you're going to pay another surcharge. The Medigap premiums vary pretty substantially. If I remember correctly, I think USC Senior Care is around $200 per month. I don't know that the premiums have been released for the upcoming year. At least they hadn't been a couple weeks ago. But that's the general ballpark, if I'm remembering correctly. And then if you have a Medigap, you may also be paying or decide to pay separately for dental and or vision coverage, because dental and vision are not covered by original Medicare. So while these monthly premiums can be very significant, right? You could be paying hundreds and hundreds and hundreds of dollars per month to have all of this coverage. But once you go to the doctor or are admitted to the hospital or whatever, your out-of-pocket costs should be next to nothing aside from your prescription drug copays. So let's shift gears here and compare what we just talked about to Medicare Advantage plans. So again, Medicare Advantage plans are private insurance plans where you have assigned your Part A, B, and D benefits to a private plan. They're typically HMOs. There are some PPOs in LA County now. There used to only be one, and now I think there's a handful. But for the most part, these are HMOs. It's managed care where you are going through your primary care doctor to get referrals to specialists. Specialty services have to be authorized by a medical group. And you can typically only use out-of-network doctors for emergency and urgent care. There are certain specific types of Medicare Advantage plans for people who have certain special needs. These are called special needs plans, chronic health plans for people with certain chronic illnesses, institutional plans for people that live in nursing homes, dual eligible plans or dual special needs plans, DSNP for people that have Medicare and Medi-Cal together. But before considering any of these plans, if you fall into any of these categories, I always recommend check with your doctor to see which plans they recommend or whether they accept any of these plans. So why, after talking about all of the benefits of having original Medicare and all of that flexibility, why would someone consider a Medicare Advantage plan? Well, it's a much less expensive option. And the reason for that, well, there's a few reasons. So first, rather than having that 80% and 20% split like original Medicare does, with Medicare Advantage, there are set copay amounts. So rather than, oh, it's 20% of some unknown number, you know ahead of time, oh, it's $20 for primary care visits, it's $50 for specialty, it's $100 for an emergency room visit, right? Those copays vary from plan to plan, but it's a set amount, which probably more closely resembles the type of insurance you may have through your employer. The other major benefit of Medicare Advantage plans is that they have an annual out-of-pocket maximum. Original Medicare does not have an out-of-pocket maximum for your medical services. And so that's one of the other big reasons why we really encourage people to have some type of secondary coverage or a Medicare Advantage plan, because if all you have in your wallet when you get your medical care is your red, white, and blue Medicare card, and you have a catastrophic accident or injury, there's no limit on how much the hospital or doctor can bill Medicare, which means that there's no limit on how much your share of those bills could be. So Medicare Advantage plans do have an annual out-of-pocket maximum. Many of them do not charge anything extra to join the plan. So you're already paying for Part B as in boy, which you would be doing either way. Many of these plans don't actually charge anything extra to have the drug coverage, and you don't need to pay for a Medicare supplement plan. So in terms of out-of-pocket costs, this is a much less expensive option. Additionally, many of these plans add supplemental benefits that are not covered by original Medicare. Many of these plans have an over-the-counter drug benefit. They have dental coverage. They have transportation to medical appointments, vision coverage, gym memberships. These things can be very appealing and can be pretty expensive to pay for out of pocket. So if you're looking to save money and don't mind having a more limited network of doctors, Medicare Advantage can be a good option for folks. But again, my first words of encouragement, if you are trying to decide between these two coverage options, is to check with your doctors and hospitals first to learn which Medicare Advantage plans they accept, if any. There are some doctors that do not accept any Medicare Advantage plans. And so if you want to maintain a relationship with that doctor, original Medicare is going to be your better option. You're also going to obviously want to compare other financial pieces, right? How much are you going to have to pay for office visits, hospital care, specialty services? How much will your prescription drug copays be? Many of the Medicare Advantage plans waive the drug plan deductible. So again, this can be a less expensive option. You can get additional benefits, but the downside is a more limited network of doctors. So I just want to share a couple of quick examples so you have a sense of, some of what we're talking about here and how this plays out in the real world. So Maria is retiring next year. She lives in California. Her daughter and grandchildren live in Arizona, and she plans to visit frequently to help with childcare. She keeps hearing about Medicare Advantage plans, but she wants to be able to go to the doctor for routine care while she's spending time in Arizona. Because of this, Maria should likely consider original Medicare with a Medigap, or if she's a USC retiree or currently USC faculty or staff and is thinking about, original Medicare, maybe she wants to look into USC senior care, and she'll have to understand what the difference is if she goes to doctors outside of the USC CAC network. But she should consider original Medicare with either a Medigap or USC senior care so that she doesn't have to worry about getting referrals when she's away from home. Sometimes when you have a Medicare Advantage plan and you're doing a lot of traveling outside of your home service area, you can run into issues with, trying to get routine care, and it turns out it's out of network and then you have to pay out of pocket. So another example, different example, Henry has had the same insurance coverage through work for a very long time, and it's an HMO. He likes his coverage. He was recently diagnosed with a chronic health condition and wants to make sure he can keep his specialists when he switches over to Medicare when his employer coverage ends. Henry is concerned about his medical expenses and needs to keep his monthly costs as low as possible due to his limited income. Henry should talk to his current doctors about which Medicare Advantage plans they accept, if any, to help him decide how to obtain his coverage. So these are two examples of folks with different needs, right? Different circumstances. And so you can see how maybe one plan coverage option or another would make sense depending on your personal situation. Okay, so moving on here to Part D enrollment periods, I already mentioned, at the beginning that anyone who becomes eligible for Medicare has what's they're called initial enrollment period. It's the 7-month period that surrounds your 65th birthday or your 25th month on SSDI benefits. But a lot of folks don't sign up for Part D or Part B during their initial enrollment period because they have employer coverage. So for anyone currently working at USC or as a spouse that's currently working and you have coverage through your spouse and they're actively working, you typically do not need a Part D plan at the same time. You don't need two different types of prescription drug coverage at the same time. So for many of you, or for some of you, this initial enrollment period might have passed a while ago. We've already talked about open enrollment. One other thing I want to flag here is that if for some reason you do make a change during open enrollment and you start out the year on January 1st enrolled in a Medicare Advantage plan, maybe you've decided, you know what, I want to save some money. I want to see, about these. I've heard good things about these plans. I want a free gym membership or, whatever it is. And then come January, you realize, oh no, I've made a major mistake. I can't see my specialist anymore. My specialist is not in the network. Or maybe you realize, oh no, I don't know what I was thinking. I don't want to have a managed care plan. I like the flexibility. If you start the year on January 1st in a Medicare Advantage plan, you have one more opportunity to make a change to your coverage so that you're not locked into that plan for the entire calendar year. So keep that in mind if you do decide to make a change or have a Medicare Advantage plan at the beginning of the year. You may be able to make one more change back to original Medicare or to a different drug plan, a different Medicare Advantage plan. So just keep that in mind. It used to be called the Medicare Advantage disenrollment period. So really it's typically for folks that realize they've made a mistake or realize they missed open enrollment and had intended to make a change. Now, there are special enrollment periods that qualify folks to get into a drug plan outside of those other enrollment periods I just mentioned. So for example, if you are currently working and you do not have a drug plan through Medicare but you do have employer coverage. When you eventually retire and lose your employer-based drug coverage, that opens up a special enrollment period for you to get a Part D drug plan or Medicare Advantage plan. So if you're planning to retire in April, that does not mean that you have to wait until open enrollment in the fall to sign up for drug coverage. If you're retiring at the end of April and April 30th is when your employer coverage is going to end, you will have a special enrollment period of 63 days to sign up for a new drug plan through Medicare. Also, if you move out of your Part D service area, let's think about that example I gave with Maria, who's providing childcare in Arizona for her daughter. Maybe she decides down the road, you know what, I don't want to be going back and forth. I'm just going to move to Arizona full time so I can provide more childcare for my grandkids. That's not unusual. If you move out of the state, or if you have a Medicare Advantage plan and you move out of the county, that also opens up a special enrollment period to sign up for a drug plan. And then we also have special enrollment periods for folks that have extra help. I'll talk about that program in a moment, but it's for folks with really low income and low assets or resources, and they have more flexibility to change their plan throughout the year. Now, I mentioned already that if you have other drug coverage, you typically do not need a Medicare Part D drug plan. So if you have other coverage that is, the magic words are creditable drug coverage. So that means it's equal to or better than the standard Medicare drug benefit, you can delay your enrollment into Part D. I know that the prescription coverage through the USC employee plan is creditable drug coverage. So if you skipped your initial enrollment period, you have your USC plan right now, you should be fine. When you do eventually lose that employer group health coverage through current active work, that is when you should sign up for Part D. And the reason I bring that up is because if you do not have drug coverage at all, and you are eligible for Medicare, you will be faced with what's called a lifetime late enrollment penalty for any month that you should have had drug coverage but didn't. So unfortunately, I talk to folks sometimes who say, oh, I'm healthy, I don't take any prescriptions, so I didn't think I was required to sign up for a drug plan. And then 5 years later or 2 years later, they realize, oh, I probably should sign up for a drug plan, now that I'm on medication, and they get saddled with a lifetime late enrollment penalty. So I would love to help folks avoid penalties if at all possible. So one question we get, do I actually need to change my Part D drug plan every year? No, you certainly don't have to. But the reason that we do this type of training and provide these types of workshops is to remind you that the plan that you may have selected last year or 3 years ago or 5 years ago, those plans typically make changes every year, including changes to how much they are charging you. And so it's a really good idea to compare your options to make sure that you're not paying more than you actually need to for the coverage that you need. For example, I know that there's at least one Part D drug plan this year. I think there's more than this, but I heard from one of my counselors this morning that there's a plan where the premium is going up by nearly $50 or $60 per month for the same coverage. So can I guarantee that there's another plan out there that's less expensive that provides the same coverage for the prescriptions that you need? Off the top of my head, no. But this is why it's important to compare your options, because there may very well be another plan available that you could switch to for much less money. And then you can spend that money on other stuff that's important to you, instead of just wasting it on premiums if you don't have to. So how do you go about doing this? Well, obviously, Jeanette mentioned already that the USC Mann School of Pharmacy is available to do one-on-one consultations. Our agency, actually did not provide the training to those pharmacy students this year. I've done it in the past. My wonderful community education coordinator did the training this year. But they use the same tool that we do, the Medicare.gov Plan Finder search tool. So I do encourage you to work with the pharmacy school to compare your options. If you'd prefer to speak with one of us at our agency, I say give us a call sooner rather than later, because we are already booking for early November. And each plan has its own list of covered drugs and copays. So it's really important to, compare these different options. This is not the best photo on here, but I did want to show you a screenshot of what the search results look like if you do happen to run the search yourself. That's always an option. You can sign up for an account on Medicare.gov, or you can do it without logging in. I would say that if you do have an account on Medicare.gov, it can make it easier to compare your options from year to year, because you can actually save your drug list and then just update it when your prescriptions change. So you enter in your prescriptions, your zip code where you live, the dosages, your preferred pharmacies, and then it will give you a list of the drug plans available, including the monthly premium, how much your total drug and premium costs will be, the deductible, which I'll talk about in a moment, which is going up to $545. And then it's sorted by the lowest cost plan. So whether you're doing this on your own, or it's something that our agency is doing for you, or the School of Pharmacy students are doing, they're using the same tool. So some things to consider: the monthly premiums range anywhere from $0 to $188.40 this year. The most expensive plan is not necessarily the best one. So I have had folks who said, you know what, money is not really a big concern for me. I just want to make this easy. Should I just sign up for the most expensive plan? And I said, no, because even if you're very comfortable financially, you could still spend that money on something else, right? The most expensive plan is not necessarily the best plan for you. It's really going to depend on your prescriptions, and your pharmacies, etc. The annual deductible, as I mentioned, the standard deductible, which is how much you pay out of your pocket before the plan kicks in, is $545. There are some plans that waive that deductible. They might charge a higher monthly premium so that you're spreading those costs throughout the year. And many of the Medicare Advantage plans also have a $0 drug plan deductible. So one thing that is really exciting about Medicare Part D, and you probably never really hear that sentence, any sentences start that way, but one thing that's exciting is that the Inflation Reduction Act has made some changes that are being rolled out sort of incrementally. So last, or at the beginning of this year, one of the big changes was a cap on insulin prices. You should not be charged more than $35 a month for a 30-day supply of insulin if you use insulin. One change that's taking place for this upcoming year is that once someone reaches the catastrophic coverage phase, which is total drug costs reaching $8,000 for the year, you will have a $0 copay for your prescriptions. Now, hopefully nobody on this call, takes really expensive prescriptions that would get you to this point. But the good news is that if you do have to get to that point, your copays will be $0. You used to have to pay 5% of the cost of the drugs once you reach this phase. What is happening is we are working towards 2025, when there will be a $2,000 out-of-pocket maximum for Part D coverage. So stay tuned. Next year, I will be talking more about that. In the meantime, we basically have an $8,000 out-of-pocket maximum for Part D this year. If you happen to have Medi-Cal or have a friend or family member who has Medi-Cal, you are required to have Part D drug coverage, and you get that extra help program I mentioned with very low drug copays. So extra help, you get it automatically if you have Medi-Cal. Medi-Cal is California's Medicaid program. However, there are some folks that have income that's a little too high for Medi-Cal, and they are still eligible for the extra help program, which is administered through Social Security. So our agency helps with extra help applications. If you or a friend or family member or someone it seems like they might qualify, definitely feel free to refer them to us and we can help them enroll. Essentially, there are income and asset limits for this program. I don't have the numbers for this upcoming year quite yet, but it is up to 150% of the federal poverty level, which this year is around $1,850 per month for a single person, or I think around $2,400 per month for a married couple. So very low income, low assets, right? If you have a 401k or an IRA or something with, you're probably not going to be eligible. But I wanted to mention this program because it is underutilized and can be really helpful. Now, one other thing I wanted to mention is this is the time of year where your mailboxes are probably full of brochures and pamphlets and postcards and information about all of these different plan options. If you turn on the TV, you might be seeing people like Joe Namath or other celebrities trying to convince you to sign up for these different plans that are available. Medicare marketing scams do target people with Medicare year-round, but this time of year is particularly rough. So there's a few things I want you to be aware of. First of all, no one is ever going to call you from Medicare. There might be people that say that they're calling from Medicare, but Medicare will never call you. Medicare is never going to ask you for your Medicare number. That red, white, and blue card should be protected the same way you protect your Social Security card, right? Where you only take it to certain appointments where it's required, right? Maybe the first time you're seeing a new doctor, they'll take a photocopy of it. But for the most part, you don't need to carry it around in your wallet with you. You might want to take a photo of it, but you might want to consider protecting it the same way you'd protect your Social Security card. We have heard from folks that have gotten calls saying, oh, we'll send you free COVID tests if you give us we just need your Medicare number to process this. That is a scam. So be very cautious if anyone's calling you saying they're calling for Medicare, if anyone's calling asking for your Medicare card number. No one should be coming door to door, etc. Right? There are strict marketing rules. The other thing I want to caution you about is that sometimes agents and brokers we know there are a lot of great agents and brokers out there that do a good job and really want to get you the best information and best plan for you, right? We do not refer to agents and brokers. We do not sell anything ourselves, but I know that there's good folks out there. Unfortunately, our agency is also the one that's often hearing the complaints about people that have been lied to, right? If you say, I am interested in learning more about, XYZ Medicare Advantage plan, but I only want to switch if my doctor is in the network. And then the agent says, oh, yes, your doctor's in the network. And it turns out your doctor never accepted that plan. What it sounds like may have happened is the agent or broker might have given misleading information in order to convince you to sign up for that plan. That is fraud. That is enrollment fraud. We also sometimes hear from folks who say, I thought I was just calling for information and now all of a sudden my coverage has changed. So be very cautious about working with someone that you don't know or trust. The pharmacy students, I think you can trust them for sure, but I know that some of these, agents and brokers, some are wonderful and some are really just trying to make a commission. So in terms of an enrollment action plan, for those of you who maybe don't have parts A and B together yet, that is done through Social Security. Social Security has absolutely nothing to do with your drug plan coverage through Medicare. They administer the A and B enrollment, and if you're collecting Social Security benefits, they'll withdraw the premiums from your Social Security check, or they'll send you the billing notices for your premiums. But once you've got that Medicare number, or maybe you already have it and you're looking at your drug plan options, enrollment into the drug plans, either Part D or Medicare Advantage, is done directly through those plans, possibly through Medicare.gov, but Social Security has nothing to do with them. So one way to narrow down your hundreds of options, there's literally, upwards of 100 plans available in LA County. Confirm with your doctors which plans they accept, if any, and then that is one way to start narrowing things down. Medicare.gov plan finder search tool, you're welcome to do that on your own. You're welcome to call Center for Healthcare Rights for assistance, or your local high cap program if you're not in LA County. Or, as I mentioned, you can work with the USC School of Pharmacy students to help compare your options. So where to get more information? Medicare.gov. Highly recommend Medicare.gov. The plan finder search tool is not always the most user-friendly, which is why we are offering these other options to help you compare your plans, but that is always available to you. You can also always call 1-800-Medicare. 1-800-Medicare is available 24/7. Our agency, we're open regular business hours. So if you wake up in the middle of the night and you realize that you need to talk to someone immediately, you can always call 1-800-Medicare. Those customer service representatives can also help you compare options. They run the same drug plan searches that we do. You can also call the Part D plans directly, but my one word of caution with doing that is that we know that sometimes informational calls turn into sales calls. So just be very cautious. If you have a standalone drug plan and you want to call your plan for more information, and they say, hey, we'd like to share some information with you about our Medicare Advantage plan, because many of these insurance companies sell both types of plans. I've talked to too many people who said, oh, I thought I was just getting information about my drug plan, and all of a sudden I'm enrolled into a Medicare Advantage plan. I don't know how that happened. That's a problem. So with that, I am happy to open it up for questions. I see that there's a few in the chat, so let me try to navigate through some of these. Okay, so one of them, I'm a retiree, but back as resource staff. I have Medicare A and B, supplement plan G. How do I use the Silver Sneakers benefit? So if your Medigap plan G includes Silver Sneakers, you're going to have to contact them directly to find out who actually has a contract for the Silver Sneakers benefit. I had heard somewhat recently that some of the YMCAs have stopped using Silver Sneakers or stopped accepting Silver Sneakers, but I know a lot of people in the past would go to use the YMCA gyms through that benefit. So I recommend contacting your plan directly to learn more, because off the top of my head, I'm not sure who actually accepts that benefit. Okay, the next question I see, can you switch back to original Medicare if you are on a Medicare Advantage plan? So yes, you can. During open enrollment is probably the easiest time to do that, because you're comparing your options for the upcoming year. So if you are currently on a Medicare Advantage plan, you can look at the standalone drug plans, make a change, and that would be effective January 1st. The thing to keep in mind is that if you switch back to original Medicare, you want to make sure that you have either USC Senior Care or a Medigap or Medi-Cal, depending on your situation, but you want to make sure that you have secondary coverage set up to start at the same time that you switch back to original Medicare. So for example, let's say you want flexibility and you're not interested in USC senior care. I'm just saying that because I don't know all the details, but let's say you want to get a Medigap and you don't currently have anything through Blue Shield. We are in that medical underwriting holiday for Blue Shield. So you could potentially try to enroll in a Blue Shield Medigap plan to also start January 1st at the same time that you're switching back to original Medicare. I believe the same would be true with USC senior care, but I will let Jeanette correct me if I'm wrong.
That's correct.
Okay, great. Okay, so one other question here. How do premium and benefits of USC senior care compare to Blue Shield? Thoughts?
I think you have to put it side by side and look at all the things that they offer. I'm not an expert about that at all. I don't know what to say about that, Stephanie.
Yeah, so for the premiums for Blue Shield or any other Medigap plan, the premiums are typically going to depend on your age. My understanding is that with USC senior care, it's not dependent on your age. It's just this is the benefit and this is the monthly premium. So without knowing more about your specific age and I guess maybe just specifically age, I wouldn't be able to tell you what the premium difference would be. I know that with USC senior care, it's you pay the monthly premium, and if you go to Keck doctors, they cover 100% of your copays. If you go to doctors outside of the Keck network, my understanding is that there's a $200 deductible, and then you pay 2% of the costs of your care. So essentially, rather than with a Medigap, they cut or with USC senior care within the Keck network, it covers 100% of your copays. If you have USC senior care and you go out of the Keck network, you have basically a 2% copay plus that deductible. But in terms of comparing the premiums, that would probably have to be a one-on-one conversation. There is another question about where can I find information about USC senior care? Jeanette, are you able to share the link in the chat maybe?
Yes, I will look that up for you too. And it's my understanding that USC senior care costs will go up in 2024. So I think it'll be $275.
Got it.
I'll get it for you and I'll post it.
Wonderful. Okay, so there is another question about telephone number for making an in-person appointment. So the way that our in-person appointments currently work, they are all scheduled at each individual site. So although we have this phone number here on the slide, that phone number is for scheduling a telephone appointment. You can always call us and ask about the in-person locations, and we can give you the phone number for scheduling at those locations. But the availability of those volunteer counselors varies. Some of them are more active than others. But you're welcome to give us a call, or you can go on our website, and our website, I believe, has a list of all of the in-person locations and the phone numbers that you can call if there's a location that's close to where you live. Okay, next question. Do the surcharges lower after a person is retired and their income is less? Is there something we need to do to make this happen? So I mentioned the IRMA, the income related monthly adjustment amount. And yes, the IRMA changes every year because every year Social Security and the IRS are sharing information about your tax records. So every year they are looking at a new tax return. If you are retiring and have had this life change, right? You've had a reduction in income and a reduction in your work hours. Those are things that you can do if you get a letter in the mail from Social Security that says you're being assessed an IRMA based on your income from 2 years ago, you have a couple of options. You can request a new initial determination if you've had one of those major life changes like retiring. If you have a more recent tax return that shows a reduction in income already, then you can request that they look at your more recent tax return. But you can always try to appeal the IRMA. I will say that if, for example, you sell your house and your tax return that year shows that you have really high income because you sold your house, you're probably going to have to pay a higher amount for your Medicare based on that, tax return. But the following year, they'll look at the new return and your income will have gone down. So if you have a windfall, yes, you will have an IRMA, but you're not locked into one premium amount forever. They're always looking at your tax return from 2 years ago, and you can certainly always try to appeal. Another question, does USC Senior Care include prescription coverage? No, it does not. If you decide to go with original Medicare and you want USC Senior Care as your secondary coverage, you do have to sign up separately for a separate Part D plan. Okay, next question here. Do Medicare or Medigap cover telehealth visits, urgent care, emergency room? So yes, Medicare does cover, does have some, telehealth benefits. It does cover urgent care and it does cover the emergency room. That's all typically covered under Medicare Part B as in boy. So emergency room, even though it's at the hospital, that's outpatient services, and Medicare Part B as in boy covers your outpatient services. Or doctor services, which is what telehealth would be. Okay, next question here. How are Medicare annual wellness visits different from an annual physical exam? Ooh, that's a good question. So the annual physical that you might be getting through your employer plan is typically much more comprehensive and may include blood work. It includes, physical examinations by the doctor. An annual physical exam, as we think about it, covered by, private insurance, is not covered by Medicare. Medicare Part B as in boy does cover many preventive services, one of which is the annual wellness visit. The annual wellness visit is more of I would think of it more of like a check-in visit to get updates from your doctor about maybe which screenings you need to schedule sometime soon. I think they take certainly vital signs and stuff like that, but lab tests, blood work, that's all billed separately. So if you have more questions about the annual wellness visit and how it compares to physicals, certainly feel free to give us a call. That was a very sort of brief overview, but I will say that the annual physical not covered by Medicare is typically much more comprehensive, whereas the annual wellness visit, you can get it every year. You do not have to meet your deductible, so it is something that is covered for free through Medicare, but it's less comprehensive, and anything else that your doctor recommends as a result of the annual wellness visit will be billed separately, and you will have those potentially, co-pays or co-insurance unless you have a supplement plan. So I think those are the only questions I saw in the chat. Happy to stick around if there are any others, but I'm glad to see that so many people were engaged, and we're here to help however we can.
That was wonderful, Stephanie. Thank you so much. Does anyone have any questions? Anyone else? Let's just take a look at the I think we're good. And I have to say, I had to step away for a second, and there are quite a few more people that would like to see your slides and see this recording. So again, thank you so much for all your valuable information. We can't thank you enough, Stephanie.
My
So,
pleasure. Thanks for having me.
so thank you so much, and we'll say goodbye, and thank you everyone for attending. Take care. Bye-bye.
Bye.